All right, welcome to the Autism Innovation Lab. My name is Shahriar Afshar, your host and CEO and founder of the Autism Innovation Lab. I'm here today with Raj Sodhi. He is one of our new entrepreneurs in residence, a startup uh, uh, catalyst, inventor, and autism dad. So both of us are in the same kind of headspace when we're trying to make the world a little bit better for our kids, and that's how we connected. And I'm so glad to have him as an entrepreneur in residence in our Autism Innovation Lab, helping the new kind of class of startups and folks that we're going to hopefully usher in to the lab, but also to learn more about Maddie Bio, his startup, which is an amazing startup. I wanted to learn more about it. I wanted to invite him to the podcast and tell us about it. So, Raj, welcome. So great to really been talking the past few months, but learn about Maddie Bio and what led you to create it and your journey, your life journey that led you to this moment. So, tell us a little about yourself and how did you end up here?
Sure. Thanks, Shar. I appreciate your support and guidance. So yeah, my name is Raj Sodhi. I'm based here in San Diego. Started Maddie Biogenetics, called Maddie Bio, because my daughter was Maddie. She's 3 years old now. At 8 months old, she had been experiencing all of a sudden various seizures while I was working from home, and have I've personally never encountered that to happen in the past. So she stopped moving. She fell on the ground. I thought she was having some breathing issues. So, and I was living in Texas that time where she was born. So we were there for a couple of years, and we experienced the seizures almost every other day. And ultimately, we went to a doctor. Doctor couldn't find out what the issue was. They tried to do their EKG, did an EEG. They went through numerous occasions. We went to the ER, and ultimately, what happened? We found that she had a rare disease that we saw from her, we call CMA, which is a chromo microarray genetic test, which is the first in a series of tests that we went through, which insurance did cover. And we found out she had 200 plus missing genes. And she had a couple of deletions and a couple of duplicates as well. So in layman's terms, it basically tells us that there's a lot of information on a report that has enough information to make anybody confused. But what it doesn't do is gives us in English language what exactly we should look out for. So these are things we had to experience along the journey from that test. So from that test, we then got her to other specialists because we went to numerous doctors to seek out, sources of issues that she had been experiencing. She had been seeing, seizures. She had difficulty breathing. We felt there was something really wrong beyond just some dysformical issues. So finally, in the ER, we ran into some doctors from Baylor, and they were some Baylor. I mean, they're amazing. They immediately, within 5 seconds, said that she had a heart murmur. And
No.
really, shouldn't her pediatrician find this? Absolutely. And so they missed a heart murmur. Then we found out that she had what they call ASD, atrial septal defect, which is a hole in her heart, which we found out that it affects about 25% of the population, which is incredible. And but most of the people generally the hole heals by itself, heals. Or you can use a fly trap method where you actually it's like a fly trap combining effort together and seal it. But neither of those were one was not happening naturally, and the second was not possible because the hole was growing too big and the blood was circulating into one side of the heart much bigger than the other side. So the side of the heart was enlarging significantly. And so then we went to and said, okay, well, what's the next step we do from this? Then we got another genetic test, and the doctors were monitoring this on a weekly basis, and we basically found that there were less, there's a bit more detail as far as the whole exome sequence test was, which is called West test. And it's a secondary test where you do a bit more detail, finite, as far as your genetic profile. And that gives us a bit more information. But we also, at the same time, put a team together of AI specialists that were part of my own background. My background is in AI for about past 10 years. And I asked them, hey guys, I need a little bit of help to better understand my daughter's situation. Here's a lot of data. We understand there's, a lot of, this is when large language models just started coming out. And I said, hey guys, let's build something on top of an existing model that we can see maybe what her condition would means. Maybe we can refine it more and see where it goes from there. And we did. So within a matter of days, really, we went and took a report that consolidated information about her genetic profile, her medical records, lot about a million or so medical journal information specific to rare disease and autism and epilepsy, and we built an algorithm around that, and we showed a final report to the doctor with like a scoring mechanism we built, and basically we saw that we can predict disease in advance of it actually occurring, but also we can better identify certain root causes that might be helpful for a doctor to maybe prescribe other medications for, or also better understand because, doctors got 15 minutes of your time. You got 15 minutes of the time of the doctor actually. So how much can you actually get in terms of providing in front of the doctor? Not very much. So ultimately, the doctor saw that she needed a better screening on her heart to see what we could do about that because that was alarming to the doctor. Now it was quite right in front of him. And ultimately, we found out that instead of waiting a year for what they suggested to get in front of a genetics counselor, who is someone that describes, they're like a, they're like a, not like they're sort of like a therapist, but kind of guides you like a counselor, like a school counselor, but they're a genetics counselor that guides you on how to understand your genetics report. But really, AI in many ways helps that accelerate even further. So by the time we met with a genetics counselor, we already knew a lot of it because of our AI. So getting back to the heart, the doctor ultimately saw, well, we needed to get her in an operating room immediately. So we got her into the operating room. They performed open heart surgery a few days later, and within 4.5 hours, they sealed her heart.
Wow.
And a year later, she was healed.
Wow.
So that part of what we built was something that we didn't really know where that was going. This journey has been a journey of finding things as we go. I can't. I didn't know what was next because I'm not a researcher. I'm not a doctor. I'm an engineer, so I look at it from a problem solving standpoint. Right? If
Mm-hmm.
I can understand what a certain situation like this, how can I potentially problem solve to know what's the next step? That's how I look at it. How I look at this.
Mm-hmm.
And so that was kind of how I started Maddie Bio.
And so, where is Maddie Bio now? I mean, what's the status of the startup? What are the range of options? Obviously, application to autism, and how AI. How does the AI really work into this project?
So what we did next was we took the we have 6 institutions that we're partnered with, and they each they each play a very unique role in how we're building out this platform. Some are good at drug discovery, some are good at stem cell development, some are good at organoid development, which I'll talk about briefly, and other things. So everybody has their unique aspect of what they can play a role in. And what I found out is, and I think that you can appreciate this, Shar, is that to be successful in not only just autism but any disease in general, it takes collaboration.
Mm,
It takes a village to solve these problems. Many companies go out there and they start them by themselves. Of course, the CEO said, it's my baby. I'm going to take it." But at the same time, you got to work with the people around you, surround yourself with really smart people, but also, create an environment that encourages collaboration and what we call co-creation,
right.
because that's what's necessary when it comes to genetics, because no one source is going to have all the data in the world to make reasonable judgments as far as AI and reporting and analytics and drug discovery goes. So you got to collaborate amongst each other.
Mm,
So what we did, we took the cells. We're taking the cells from Maddie now, together with University of Washington and Fred Hutch Cancer Center, and we are uh, creating our first cell line or alongside what we call UNC80, which is a cell deletion that she has experienced. And so we are that's in process right now. It takes about 8 to 10 weeks to get created, and then that'll be our first foundational model, which we can then start publishing data around, and we'll be measuring that against Maddie's actual genetic profile, so we can then see which particular cells need some work on, and the work meaning that we can take these cells and put them into a model or a framework or an environment and simulate how drugs, based on their chemistry, would react with those cells. And then you can actually physically put that in a lab and see how those drugs, based on what your AI has told you, may have a better chance to help improve the result of those cells, maybe regenerate those cells. And
Mm,
over time, you can see if there's a certain drug that may actually help a lot of the conditions that a person experiences, in this case with autism. And this can also go for any type of disease. So we go from our prevention solution, which I talked about, down to our precision solution, where every person, whatever condition they may have, in this case autism, can identify and get a precise understanding of their body type and how it aligns with what medication and dosage that may be most suitable for them. In my case, we repurposed a drug from purely our AI in June, and with researchers and therapists and insurance support. Maddie's epilepsy is now remission. It's now in remission. She no longer has it, but also her epilepsy for level 2. She's becoming more verbal from her nonverbal side. She's gaining more confidence. She's more balanced. She's just overall improved significantly from where she has been, and
mm.
we think that can further improve once you get into the chemistry of things, and that can go for any patient. But this is all good and said, but the tasks at hand right now are very manual, right? So there's a lot of lab work, a lot of intervention required, a lot of researchers that move different pieces from one centrifuge to another machine and so forth. So there's a possibility for some error that may occur in these handlings. So what we're envisioning at Maddie Bio is we're going to automate this process into a biological computer. So basically, it's a one-stop shop for including robotics that basically tests a sample of your genetics and goes through this process of bioinformatics, identifies and takes the stem cells and creates this whole precision approach to medicine for your based on your condition, and that'll be available in clinics that we're hoping in the next couple of years. And
Wow.
we're working on a prototype of that. And so iteratively, we're going from manual to automated. We're going from what cost a person $3 million from a diagnosis to creating a rare disease drug down to about where we want to go is about $60,000, and we think that's very approachable using the techniques that we are putting into place in the community we're building. So
Right.
that's what we're building with Maddie Bio.
Wow. That's amazing. So where you are now with a startup, what is your kind of investor pitch, the elevator pitch to investors, and obviously how Maddie Bio is, let's say, different than other startups, and why investing in Maddie Bio can be transformative? Like, what is that
Yeah,
punchline?
so our we're raising $5 million right now. Our approach is quite simple. We have the researchers, the labs, the model in place. We're looking to raise $5 million to develop a clinical mini trial that we will look uh, at creating a new indicator based on a therapeutic that would help those with autism, and those that would invest in this will be able to invest in up to 10 families that will go through this mini trial that will be held at CSD in collaboration with other institutions, and within a period of 6 to 9 months, come up with a complete precision medicine recommendation for the specific set of patients. And ultimately, if we have a suitable drug that comes out of this that might be either one or two, we would be working with the state of Montana. And because the state of Montana has just approved new scope for bringing medication to market rapidly within 1 or 2 months of accelerated approach, and we've been in early conversations with Congressman Berger out there as far as bringing this as a mini trial out there as well. So this investment is very transparent. It's tangible because you're going to see how it goes from the start of the prevention to the precision approach occurring in the lab itself. So the KPI is you'll see that some patients may benefit and some may not, but we have to do it as well with a we call a placebo and actual drug test. So you see, if there's someone not on a medication, they're not going to be impacted, obviously, through this trial. But those that are, will see some significant effect depending on their genetic profile. So that's what our intent is for this investment.
So, just going back to the logistics, I guess this isn't obviously a new medicine. It's applying existing meds, right? In the right
Yeah.
dosage,
So
match with the right genetics to find the application, which will be obviously far beyond autism. Autism is one of the things that drives me and you, but it has other applications, and there'll be a lot more testing, lot more institutional partnerships. It's all could be, the rubber may hit the ground in Montana to kind of because of the favorable nature of, I guess, drug testing requirements in that state. Um, and right now, the website is maddiebio.com, right?
yes, it's www. It's Maddie Bio MADDIEBIO.com.
.com. And apart from obviously investors, are you looking for any more institutional partners? You mentioned UCSD, obviously, but anybody else? I mean, do you want to list the seven that you mentioned? Like, what is that universe
Yeah.
look like?
So as far as our partners are concerned, we have UCSD. We have Fred Hutching Cancer Center in Washington. We have University of Washington as well, and we have Baylor University. We have Columbia, and we have Houston Methodist. And Houston Methodist is a bit unique. They're using our AI platform for cancer patients, and we just got approved from the IRB there, and so they're rolling it out with 100 patients to start with cervical and ovarian cancer. Like I mentioned, our platform, our AI platform can adjust for the disease type. But like our conversation is going, we're talking about autism today. But that's what we are, what our list of partners are. We have been approached by some foundations as well that have stem cells, and they themselves are very interested in collaborating because obviously they have a very large library and laboratory of stem cells that are based on various different conditions. And but we had talked before, rare disease, when it comes to rare disease, autism is a symptom of one of those symptoms that are exhibited in many of these rare diseases that I'm seeing. And so what our approach is, because in Maddie's case, I don't exactly know what the rare disease is. We're going through still a long read study with Baylor. But as far as how I want to approach it is go after all the biomarkers and see how we can address the symptoms. Because if we can help her symptoms, we can improve her quality of life. I'm not looking for a cure. I'm looking for how do we improve the quality of life,
Right,
because improving the quality of life allows me to also, in this case, he's been taking off her epilepsy drugs,
right.
and by doing that, one, it's a huge cost savings to insurance. It's about $15,000 a month that's saved by insurance and pharma. But the second thing is, it's a significant improvement on the medication that's not impacting her brain any longer, because these medications are they're very strong, and especially on a child or a baby, they make a tremendous impact on their brain. At least I'm not a brain surgeon, but by talking to my family members that are neurologists and neurosurgeons, they can have effect long term
Yeah.
on the brain functionality. So the less medication necessary, the
But
better.
but believe me, you touched on all the things I think parents want to hear, but I'll just finish with this because in our last minute, not searching for a cure, but just quality of life. And I know a lot of parents, especially the autism self-advocates, autism is become kind of a part of the identity of our children, and I would never do anything to question his identity. Who am I? My job as a dad is just to help him be the best he can be, like you're doing for yours. And the collaboration and just the knowledge. I went through all those genetic testings too. I mean, I've talked to many dads and many parents where they just want to know. They're not looking for a cure. They're not trying to, fix, quote unquote, their kids. They just want to know what's going on. And a lot of these kids have a lot of other challenges, as you mentioned, like yours, that are not always apparent. It takes so many years of expensive testing and time and stress on families. So at the end of the rainbow, I want to say, apart from this, I feel transformational journey that you're on, you're also helping parents just cope and have a little bit less stress, a little bit more knowledge, a little bit more science in their lives. And at the end of the day, our kids benefit. Raj, thanks a million. The website is Maddie Bio. Please visit it, support this great transformational product. And of course, like I said, Raj is one of our new entrepreneurs in residence. So you're going to be seeing a lot more of him at the Autism Innovation Lab. Thanks so much for joining me, Raj.
Thanks for your time.